I'm doing a series talking about caregivers of various interest groups for the next couple of weeks, because my friend and colleague Tamar Mazel and I are reinitiating or rebroadcasting our series on caring for the caregiver through the month of July. It's Monday evenings. And because we see that this is such a crucial issue for English speakers in Israel that wasn't really being addressed. So I thought that I would dedicate some of my Facebook Lives to important information to know for caregivers when they are caring for loved ones. And this week, I'm going to be talking about caring for those who have adult children with mental illness. I have had in the past, and I currently have a number of clients who live with this difficult issue, and I realize that there's some things that people I think really need to know that maybe isn't evident. So the first thing is, when your child turns 18, there are a number of changes that happen with a mental health diagnosis. So first of all, as a parent, you will no longer have access to their medical records, to talk with their doctors, to schedule their appointments, etc. So if you want to have this information, you need to make sure that you have a power of attorney, a medical power of attorney in place, signed by your child, that will allow you to have this access. This is important in order to offer good caregiving to this child. The second issue is, if your child is receiving disability from Bituach Leumi prior to age 18, they will need to reapply after age 18 and go again. And reapply again. And it's the same thing that you did when they were a child. You can do it online. You need letters from the doctor, but the emphasis here needs to be on function and how function or lack thereof affects the child's ability to work, because adult disability is based more on someone's ability to work and less on just in general function and diagnosis. So those are important to note when you ask the doctors for letters, and make sure that you're asking medical professionals who have medical degrees. So, for example, a psychiatrist, if needed, a neurologist, the letters of discharge from hospitalization, etc. A psychologist letter can be helpful, but only as an additional and not as the only letter that you are submitting to Bituach Leumi. That is the first thing, or the second thing. The third thing is the ability to apply for Sal Shikum, which is the basket of rehabilitative services that is offered specifically for mental health issues from the Ministry of Health, not connected to Bituach Leumi. Yeah. Now, you can apply to this in two ways. One is by having at least 40% disability in the mental health diagnosis from Bituach Leumi. You can also apply directly to Sal Shikum without any paperwork from Bituach Leumi, either because you don't want to do Bituach Leumi for whatever reason, or if you are a new immigrant and you are not eligible for Bituach Leumi services that first year after you make Aliyah, you can still apply to Sal Shikum or the rehabilitative services through the Ministry of Health. This is very important to note. And that is a way to do that on the Ministry of Health website. They have the forms. Always feel free to send me a private message if you need more information about that. So those are the important things. And even if you're getting Bituach Leumi and you're getting special services, you're getting Shirutim Miyuchadim or special services in addition your child is receiving, it is very helpful to apply for Sal Shikum, because that will open up a number of doors, either now or in the future, in terms of what programs, either at home or in a living situation, they can apply for that will be subsidized by the government, because if they're not subsidized, they're extremely, extremely costly. And it also will provide you and your child with a social worker / case manager and somebody who will accompany your child, either in terms of helping them with a job or getting them to being able to offer them something to find some kind of recreational activity. So I highly recommend that you pursue Sel Shikum if you already have for your adult child to offer those existing type of infrastructures. I just also want to say, which is probably an obvious statement, but I think it needs to be said and heard sometimes, is that this is extremely, extremely difficult. To be a primary caregiver of an adult child who has a mental illness, who you know will never be able to live fully independently without some type of assistance or your intervention or someone else's intervention, is a very challenging thing. It is painful as a parent. It is challenging on an emotional level. It is challenging on a logistics level. Sometimes it can be challenging on a financial level. So I just want to reiterate that you have to sometimes remind yourself, okay, this is a very difficult package, and make sure that you as the caregiver are supported. Make sure that you have a therapist as the caregiver. It's extremely important for you to be able to talk to somebody. Make sure that you are not putting yourself in financial danger in order to help your adult child. If there are two programs, one that is sponsored by Sel Shikum and the other that is private, that you think maybe will be better, but it means you taking a big financial hit, please think once, twice, and three times about making that choice, if that's the right thing to do. Obviously, we all want to do what's best for our child, but we also need to think about long term. Will this really change things long term? Obviously, it depends on the child's diagnosis. It also depends on your financial situation, on your mental health situation and resilience. So please, please, please keep that in your decision-making process. Yes, and make sure that if for some reason you also are suffering health issues at the same time as your child, that you do not delay seeing a doctor, and that if you also are under retirement age and you are eligible, your health is sufficiently affected by whatever it is that you have, that you are unable to work, please pursue getting disability payments for Bituach Leumi, and don't put that off, because you also are the caregiver and need to take care of yourself just as much. In addition, when you have other children, you also have to make sure that their needs are not being pushed off and that their needs are being met. Make sure that you find out about additional activities that may be available for them, sometimes through the Ministry of Welfare. If you meet the criteria of the Ministry of Welfare, do not be embarrassed about applying for their help, because they can also offer assistance to children who are younger, under age 18, who could also benefit from mental and psychological support when you are battling with this kind of issue. So I think I've touched on the main points, and I don't want to keep blabbering on. Please feel free to post a comment if what I said to you was meaningful, or if you have any questions that you feel are relevant for the group, please let me know. Also, please feel free to private message me if you have any specific questions, if I can answer. Thanks so much for joining me, as always, Sunday mornings in Ask the Healthcare Advocate Live, and join me next Sunday morning as well.